my presentation is on comparing the COVID-19 vaccine information in Indonesian and Singaporean online news. And this was done as a project with 3 other team members. So these are the team members that have made this project possible: Alan, Shrija, and Eding, who unfortunately couldn't be with us here today. Some of them are moving home, I think. So yeah, the task has been handed to me to represent the group to share about our findings. And this was done for a module that we did in semester 1 early this year, which was the Science in the Media module, under the guidance and mentorship of Matt Nurse and Marin McKinnon. So I think all of us here, we've all lived through COVID. We all know COVID vaccines, and the pain about get vaccine hesitancy and getting people to vaccinate. So just going to talk about it really, really quickly, just for a bit of scene setting. So the World Health Organization has have guidelines that emphasize vaccines as the key mitigation measure to ending the pandemic. But trust issues, religious concerns, and a lack of knowledge contribute to vaccine hesitancy. The public can be influenced by information that have been accessed through media sources. And according to Alan's 2002 book on media, risk, and science, once people leave the education system, the news media become their principal sources of information about science. So what we say in the news, what is being communicated to people is really important as well. In this study, what we were considering is that we want to look at and understand cultural and behavioral factors and look at the vaccine communication via news media, which tend to help to shape vaccination strategies, or could be, as a result of strategies that, then it goes into the media. Interestingly, there has been no prior research that has been out there comparing vaccinations in the media in Indonesia and in Singapore, and then comparing those two as well. So that's why we decided to embark on this mini project. So just a little bit of study context, just in case people are not sure where these 2 countries are. This is a map of the Indo-Pacific, and you can see Australia is at the south over there, and Indonesia is a collection of many islands. That whole circled area is Indonesia, and that little star there, that's Jakarta. That's the capital of Indonesia. And Singapore is a little red dot right at the slightly north of Jakarta. And it's really near to Indonesia. You can take a 1 hour, 45-minute to 1 hour ferry ride, and you'll reach the nearest Indonesian island. So it's very near, but they are vastly different countries. So a lot of people have been asking us, why do we choose to study these countries? And it's mainly because I'm from Singapore, and I've always been quite interested in COVID-19 and vaccinations and how do we combat vaccine hesitancy. And my group mate Alan, he's from Indonesia, and he himself on his own has been really interested on this topic as well. So this is a casual conversation one day when we were talking about COVID-19 and how our countries have managed it and mitigation measures. And then we realized that we have vastly different concerns in Singapore and in Indonesia, and that media portrayals of the vaccines are very different as well. And this is just based on our lived experiences. And then it just so happened that Marin said, "Oh, you have to do a project on some kind of science in the media," and we were like, "Oh, that's just too coincidental. We have to do a topic on this." And so that's why it was mainly to fulfill our curiosity, but also to get better grades as well, because we were more personally motivated. So yeah, Indonesia is the largest Islamic population in the world, with about 229.6 million Muslims, whereas in Singapore it's multi-religious and it's quite secular. There's we do have a majority race, but religion is not like, there's no overarching predominant religion. In the context of COVID-19, Indonesia has been dubbed as Asia's new pandemic epicenter, whereas Singapore has been praised as highly effective in COVID-19 management and mitigation. as of January 2023 this year, only 62.68% of individuals in Indonesia have been fully vaccinated. And in terms of fully vaccinated, I'm referring to double dose or the full dose of the vaccines. Whereas in Singapore, it's 90.9%. So 30% difference is quite a big difference in the population size that's being fully vaccinated. So vaccine hesitancy in Indonesia has mainly been about safety concerns and about the halal status of the vaccines. So whether the vaccines are permissible under Islamic law. And in contrast, in Singapore, so many people are vaccinated, so many people are quite compliant in the regulations. So there's a lot of focus on the use of technology to integrate data, physical distancing, and infection tracking. And this focus on tech has actually resulted in Singapore being the first country to launch a nationwide digital contact tracing tool. In terms of media, in Indonesia, media is the main source of information on COVID-19 health protocols and general information. And in Singapore, mainstream news media is considered the most trusted source of information by the public. So our research question was, is there a difference between the way COVID-19 vaccination coverage is presented in Indonesian and Singaporean online news media? And these are divided into two sub-questions, which is, are information framed in a religious or scientific perspective? And can we compare and contrast the thematic content of news articles? So our methodology, so what we did was mostly derived from Constantini and Fuse 2022 and McKinnon et al. 2017. And we basically harvested our news media articles from the Factiva database. We limited them to the 1st of December 2020 to the 31st of December 2021. And this is because vaccine rollout for Singapore began in December, on 30th December, and in Indonesia it was 13 January. So we decided to, on a month-long lead up to the vaccination program, because we anticipated that there would be articles addressing efficacy, safety, and other concerns prior to the rollout. And realistically speaking, 13 months of COVID-19 vaccination news is way too much already. Just doing a rudimentary search was, we got so many hits, we had to reduce it just for the sake of the project. We also focused on only English language articles and English language news media. So in Singapore and in both countries, we took the highest readership, the new online news portals with the highest readership. And in Indonesia, it was Jakarta Post, Jakarta Globe, and Tempo Magazine. And in Singapore, it was the Straits Times, Channel News Asia, and Today. And just from these, and our search with the limits that we did on our search, we got 2,811 articles from Indonesia and 21,987 from Singapore. So it's a lot to filter. Given that we only had, I think, about a month from our proposal up to submission of the report, we had to reduce it dramatically. And what we did was we took the first 200 articles and screened them for relevance, used a random number generator to select 50 articles from each country. So we had a total of 100 articles that were analyzed and coded, 50 from Singapore and 50 from Indonesia. So what we did in terms of content analysis, we were looking at three broad categories. The first one was the source of information. So were they cited directly, or did they write the article or the opinion piece, or were they indirectly quoted? We included all of this. And so these are the different categories. So politician specifically refers to elected government officials. They had to go through an election process. The second one was government officials. So it could be a very high-ranking official that wasn't elected. For example, in Indonesia, the government structure is such that ministers or ministers of state, heads of ministries, they are not elected officials. So the president chooses who he wants to head the ministries. And so these fall under government officials just based on the definition that we have. And then the third one was government bodies. So like the Ministry of Health or Ministry of Education. And then we had researchers in the relevant field, which were like epidemiologists or immunologists or medical researchers. And then we had religious leaders or authorities. So for example, the deacon of a church or an imam. And then we had a member of public. So just any lay person, you, me, anybody else. And then everything else that weren't captured in these categories fell under others. So health workers or representatives of professional associations. We also categorize them according to the type of article, whether it was hard news, so which usually front page news, short and sweet, feature articles, much longer, almost 1,000 words, more detailed, more in-depth analysis or sharing, opinion pieces, so written by a non-journalist, like a scientist, a forum, so like just a letter writing into the news portal, and then others. And we also looked at thematic content. So was it predominantly religious? Did it have religious themes? Was it all scientific? Did it just mention science, science, science? Was it mixed? So a mixture of religion and scientific themes, and then others. For example, we had one about COVID-19 insurance and how vaccinations will help you. So that was, these were the categories that we looked at. So what we had 100 articles divided between 4 members. We coded the same subset of 20 articles to ensure intercoder reliability. We discussed the coding, argued a bit, and then agreed with one another finally. And then knowing that since we're all on the same page, we went off individually and coded 20 each. So 10 from Singapore and 10 from Indonesia, each person would code. These are the results that we got. So you can see on the far left here, hard news dominates all of the articles. Indonesia much more than Singapore, and then followed by feature articles. So where Singapore has much more articles than Indonesia. Okay, and then we don't really have a lot of forum and not a lot of others. So predominantly hard news. In Indonesia, these were the number of articles that were quoted in each source. So you have the government officials that are cited a lot more than anybody else, and then it's closely followed by researchers and politicians. And this is the thematic content. And interestingly, overwhelmingly scientific themes as compared to religious or mixed themes, and government officials once again followed by researchers and politicians. So this is very surprising for us. And then for Singapore, you have mostly researchers that are being side-quoted, and then you have the politicians as well. So really interesting difference in the two sources that was quoted. And then for Singapore, as what we expected, we did get a lot of scientific articles and not so much of religion, very little religion, and mixed as well. So quite a bit of others as well, but mostly scientific. So the results, as I mentioned, the results for the Singaporean news media were expected. We saw a lot of researchers in the related fields as a main source, and it was predominantly scientific themed. There was a wide range of articles, which included fact-based reporting, probing discussions, and personal views. So a lot more opinion pieces, and some of them came from the conversation. And for Indonesia, it was really mixed because there was a lot of higher number of government officials and government bodies that were cited, but we did expect religious themes and discussions on halal status. As I mentioned before, Alan is an Indonesian, and to him, his lived experience, and to many of our friends, halal status was like all over the country. It was a massive discussion across, everywhere. But interestingly, in this research this project that we did, we found mostly scientific themes. So what we felt was that, the political, in terms of sources, the political environment may influence the article type. As I mentioned, Indonesia is a multi-party. It might prioritize hard news to keep up with latest developments, whereas Singapore has a more centralized government structure and it's a more stable political environment. So there's more space for feature articles. The similar numbers across the sources in Singapore media can demonstrate impartiality in the news coverage, and this may have led to increased trust and increased vaccine uptake. Singapore media is also often criticized for a lack of editorial independence and pro-government and being pro-government. So they may have compensated for this by citing more researchers and allowing vaccines to be separated from politics. But Indonesian media are private owned, but they might have political leanings, and this may account for the higher number of politicians that are cited. But ultimately, there's no stark difference between Singaporean and Indonesian media. So I'm sorry you had to sit through the whole talk just to find out the answer. But yeah, from what we found, no stark difference. So some limitations that we only focus on English language news media, and we did not account for Bahasa Indonesian language media, which so that's a massive limitation. As I mentioned before, this is a project that was done for an assignment, so we had limited capacity and time, so a little bit of a smaller sample size. And government structures in both countries are different. As again, I mentioned earlier about the ministers not being elected in Indonesia. So this might have affected the analysis of the sources. So last slide, we saw that both countries framed COVID-19 vaccines from a scientific perspective. Very expected for Singapore, very surprising for Indonesia, but I have to emphasize this, which my project mates really insisted that this is only preliminary empirical data. We are unable to draw specific conclusions from just a small mini project like this. We do need further research, such as expanding the data set, looking at social media analysis, because a lot of discourse happens on social media. We also have discussed the potential of using AI and machine learning to improve analysis, just to reduce the reliability on, over-reliance on decoders, and possibly the use of a translator so that we can look at other language articles as well. So we hope that this small project has shed light on some of the strategies that's been used to communicate with the audience, and fingers crossed that countries would learn from one another to improve their communication on issues such as vaccines. And that's pretty much it. Yep.
Thank you so much, Priscilla. Everyone, please join me in thanking Priscilla for an amazing discussion and research that you guys did in such a short time frame, yet with some really interesting insights. So thank you so much. Please, everyone, share your questions and comments in the chat. We'd love to see them. I have a question. Do you anticipate similar results if you were to expand the data set to include articles in Indonesian language?
So we had this discussion, and we were thinking of doing a full project on it. I think we do anticipate that we will get vastly different results. In Indonesia, only 30% of Indonesians speak English, and so it's the higher educated individuals. So analyzing only English language news media means you're only looking at a very niche population, which may not be so concerned about halal status of vaccines or religious status, and the opinions of religious leaders. So definitely looking at Bahasa Indonesia articles, we do anticipate that we will get what most of our Indonesian friends have experienced, which is more religious themes and less of the scientific emphasis.
That would be really interesting. We have a question from Tremaine, who says, thank you for the talk. We found it very interesting. Their question is, do you think the fact that Singapore has stricter laws might have affected the vaccination rate, such as the Trace Together app in Singapore, etc.?
I think that, so this goes down to cultural differences, which is something that we didn't, definitely. I mean, as a Singaporean, and this is discussed a lot, we are very obedient people in Singapore. So when the government tells us to jump, we say how high sometimes, especially with COVID-19, where, all of us were very worried, I think. So having the Trace Together app, which was the contact tracing app that the government developed, and it indicates whether you are vaccinated. And the law in Singapore was that you can't enter shopping malls and air-conditioned spaces, or eat in like a food court unless you're fully vaccinated. So having all of these laws would have definitely pushed our vaccination rate up to 90.9%. I'm not sure about Indonesia and their laws, but when you look at the portrayal of vaccines in the news media, there's not a lot of mention on vaccines. You have to vaccinate to follow the law. When we did our search, and I didn't share the search terms, but we did COVID-19 plus vaccinations and vaccine. We didn't look at most of the articles that we got wasn't about following the law. It was more about efficacy and how does it help? How does it prevent you from getting, like, your symptoms are not as bad as if you did not have a vaccine. Yeah.
Very interesting. Yes, lots of cultural and language issues to uncover.
Yeah.
Jirana asked, what about if we were to compare to a Western country? What do you think we'd find? Although you might say that Singapore could be a Western country.
Yeah. I think it has the it's very westernized, but in an Asian context. So there's a lot more collectivism in that sense. A lot of things that are, oh, this is better for the community. It's not so much of the individual perspective. So I think that if we were to look at it from a Western context, we might actually look at different categories for the thematic content. Instead of just religious versus scientific, we might look at for example, are we emphasizing on the individual benefits versus the community's benefits? But if we were to look at it in a religious context, from what from religious and scientific context, I understand that Australia now is increasingly more and more people are replying to the census and saying that they are not what do you call it? They belong to any religion anymore.
Yeah.
So could be more emphasis on scientific efficacies, effects on the body, long COVID instead of religion.
Very, very interesting. Tony says, interested to study our news. We have a disinformation project that analyzes all media for all disinformation, and they must use AI to cope with the data. We lost only a few thousand people in the last 2 years to COVID, so interested to compare our media streams to your study. I think Tony's located in New Zealand, so yeah. He's interested in the AI aspect of perhaps using that to study the data. And Wes Ward says, never underestimate the impact of language on science communication, especially considering the spectrum of international, political, and economic issues. And Preeti asks, what are your thoughts on the application of this expanded research? For example, could it help countries vary their media approaches?
Yeah, for sure. I think from this study, when I was talking to Alan, who's from Indonesia, he himself personally felt that, Indonesia should learn from Singapore more. But it's always a different cultural context. But for him, his interest was to see how did Singapore media tackle this, how did they communicate it, and definitely trying to bring it back to Indonesia and apply it in the Indonesian context, and communicate it with the science journalists there, or just journalists in general, to, like, you can look at other countries to strategize and to maximize your the goals that you're intend. Like, for example, for vaccines, we want to have higher vaccination rates. How is a country like Singapore, who's, yes, we're very obedient people, but how does the media play a part in that? So again, it's also a lot of different cultural contexts. There's not a lot of political stuff in our media, just because of the stability of the government. So definitely something that other countries can look at to vary their approaches. I would be interested to look at Western Australian perspective, for example, doing the same thing, and then see how do we tackle that? How can we compare our media strategies? Yeah.
Yeah, super interesting. Thank you so much, Priscilla. And Charmaine, thanks you for your explanation and says good luck with your
Thank you.
research. I found it a really interesting talk as well. The RDC where I work, we have tools for text analysis, and one of our projects, one of our infrastructure was used by a project to analyze Twitter data on mentions of COVID and saw how the discourse changed over time, which was kind of from a linguistics perspective. So
Yeah.
I'll share that article with you, but I think that, you know, the kind of mass analysis of data, there's lots of potential there to bring in some computational and data analysis tools to look into that further, which could be super interesting.
Yeah, for
Lots of
sure.
potential. Yeah, and also the media perspective of what is the best way, what fits in each cultural context to be the most successful way to communicate science and health science is so interesting.
Yeah, especially with COVID-19 as I think we can say it as a case study now.
Yeah. A very special case study.
Yeah. But I hope that it helps us to prepare for, knock on wood, future pandemics like this. Yeah, so that, you know, I think it was a bit of a mess in the past 3 years. So hopefully with these kind of studies, we can better prepare for the future.
Yeah, absolutely. I love that very practical and positive twist on the research and the opportunities for science communication in this space. So thank you very much, Priscilla. Please, everyone, join me in thanking Priscilla again for a fantastic talk, and all the best with your future research.
Thank you.
Thank you.